It's taken Fatma Juma nearly a week to bring her 2-week-old daughter to this health clinic in the displacement camps in Bau in Sudan's Blue Nile state. A camp resident herself, she said there was no available treatment near her shelter nearly 4 kilometers away, and her financial conditions forced her to wait days before coming here.
My daughter developed a fever and then began coughing. I took her to a clinic near our shelter, but they said they had no medicine available. They were not even able to vaccinate her. I had to wait until I could borrow money for transportation to come here.
Bau is home to nearly 300 displaced people, many of them former refugees who fled fighting in the Blue Nile region in 2011 and went to neighboring South Sudan. They returned last year, hoping to make their way to their villages. But the war between the army and the RSF forced them to remain in displacement camps, where they say the aids have been reduced due to funding cuts. But the need for medical care continues. This clinic, run by the aid organization Doctors Without Borders, or MSF, is one of the few here in Bau. Samira Jaber brought her 3-year-old son here from her shelter at the displacement camps when the nearby clinic told her they didn't have medication for his malaria.
The clinic near our area is very small. People go there for help, but they mostly register patients and refer them elsewhere because they do not have the proper treatment available. They registered me and referred me here, and I had to walk because I could not afford transportation.
Doctors say they receive more than 1,000 cases per week, and that many of the cases are the result of aid cuts on programs such as food and treatment and sanitation.
The other health actors and humanitarian actors who are working beside us, when they found themselves in the position to hand it over or to suspend majority of their activities, this making more people they came into our mobile clinics. For us, I think we are more stabilized in terms of the activities in comparing with the needs. That's why we have a lot of patients they arrive to our clinics.
The rainy season is approaching, and doctors here worry that more and more people will be in need of medical assistance, putting a strain on the few functioning clinics to respond to the world's largest humanitarian crisis. Hiba, Al Jazeera, Bau, Blue Nile State.